And we are going to pick up with agenda item number 8, which is our board member training. I will let Jason Kaiser kind of introduce the training and maybe say a couple comments about possibly pausing or making some notes to come up with discussion points when we pause or at the end of the video.
Thank you, Madam President. As I kind of alluded to earlier this morning, this training came as a result of FSBPT's Leadership Issues Forum. And we've taken...
sorry to interrupt. Just wanted to see if you wanted to do a roll call vote before we start.
Roll call.
We still have a quorum.
Great idea. Yeah, we're just kind of going here. Thank you for that, Ms. Elby. And Brooke, can we please have roll call vote?
Alicia Benaman.
Roll call, sorry.
Alicia Benaman.
Here.
Katarina Elby.
Present.
Jesus Dominguez.
Present.
Daniel Drummer.
Hi there, I'm here.
Sonia McMillian.
Present. Way to just jump right in there, President.
You guys got my back. Thank you.
All members are present and the board has a quorum.
And Ms. Elby, a special thank you from legal counsel.
My pleasure.
So picking off where I prematurely started, so this training that we're presenting today is a product of FSBPT's Leadership Issues Forum. We've taken about 3 trainings now, and I believe there's about 3 to 4 more scheduled between now and October's Delegate Assembly. This one in particular I thought was, I think, especially kind of pertinent to us. It really focuses on, as board members, the prime directive of consumer protection and keeping that kind of separation. So I figured, you know, wanting to have a component of training at each and every board meeting, this kind of fit right in, and it was opportunistic. The other trainings are also, you know, really valuable, and we may be bringing a few of those to a future board meeting for the board's consideration. So I'll have the solid facilitators go ahead and queue up the video. Members, if there's a point during the video that you really want us to kind of pause the video and have a discussion, please, you know, feel free to break out with either a comment in the chat or even just, you know, unmute your mic and bring it to our attention. And I'll ask the administrator or the facilitators to be kind of especially watchful for that, and we can pause the video. I think there'll definitely be conversation at the end part of this video, and as part of the video presentation that I took it was live. So there is a Q&A kind of session from members of other boards from around the United States. The attorney that actually presents this training is very matter of fact and delivers the information very efficiently. So I think you'll enjoy it. Having said that, I will just have them queue it up and start.
Good. Thank you for joining us. We're very glad to have you with us. I actually got to meet Rebecca back in the old days when we were able to travel to conferences, and she was a speaker at the FARB Forum in Colorado. So a little bit of background: professor at Vanderbilt University, and she studies public policy and regulatory infrastructure of professional licensing. So she's going to talk about something that's right up our alley, and it's her area of expertise. She's also working on a book about licensing boards, and I think after you hear her speak today, you'll be interested in that book as much as I am. I think that the presentation that Rebecca is going to do today is really intended to be thought-provoking, and I'm hopeful that as you all are listening to her today, you will find it thought-provoking, and really in terms of thinking about how regulators can do their work to the best of their ability and in the interest of the public. So I'm very much looking forward to this, both Rebecca's presentation and your questions and comments at the end. And with that, thank you, Rebecca, and I'll turn it over to you.
Okay, well, thank you. I'm thrilled to be invited to do this. You know, it's a little hard to give a presentation to nobody, I guess, to my camera. But if they can do it at the Democratic National Convention, I guess I can do it here. Part of the reason why I wish I had a view of my audience is because some of the stuff I'm going to say might feel a little bit edgy to you. And part of that is because I came at this from the angle of antitrust and competition. And I'm sure you guys know about the NC Dental case, or as Farb likes to call it, the case that shall not be named. That's a case that I strongly approved of. I was an amicus in that. I filed a brief advocating for the result that came out in that case, cited in that case. But I hope you don't see me as the enemy, because especially in the last couple of years, as I've shifted my research methodology, my perspective on boards and board work and the people who do it has changed. I still have some beliefs that we're not doing it efficiently. But of course, I've also gotten to know a lot of really excellent board members who really care about their work, and that not even a lot, like all. And so that has sort of shifted my perspective on these questions a little bit. Okay, so I might as well start at the beginning for me, which was North Carolina Dental. So wrote an article before that case came out called "Cartels by Another Name. Should Licensed Occupations Face Antitrust Scrutiny?" The theory of this was that licensing boards, being made up mostly of competitors, are cartels. They are competitors that have the power to set the terms of their own competition. They can decide who's in and who's out, and they can also set rules that affect competition. And so they're cartels. And that would follow, what would follow that is the conclusion that, private ties to regulate and to outright exclude their own competition will do so inefficiently for consumers. So you would be forgiven for thinking that I had this kind of view of the licensing board, right? I call this the mustache twirling cartelist. And there's a way in which I was right that are cartels. They are in the sense that I learned in my research for the following article, that there are almost 1,800 licensing boards in the US, and almost all of them, so 85%, but for various reasons the number is probably higher than that, are dominated by people holding the very license that board is meant to regulate. Okay, so is this what we're talking about or something else? So I went into my research for the next project, which is this book that I'm doing, saying I'm not going to look at statutes and Westlaw and cases. I'm going to actually start showing up to board meetings. And I'm going to sit and listen to the people as they regulate. I'm going to try to get to know them outside of that context, talk to them about their work, try to better understand their perspective on what they're doing. And after a few months of doing this, I sat down with actually a member of a PT board. She was the public member, and we sort of laughed about how I had this mustache twirling cartelist idea of what these boards were like. And she said, never ascribe to malice what can be ascribed to incompetence. Okay, that's from Napoleon. So right off the bat, I've basically said that these boards are either mustache twirling cartelists or they're incompetent. No, that's not what I mean by incompetence. What I mean by incompetence is not incompetence in the sense of being extremely professional, excellent providers of care. So if you're talking about a medical board, it's full of very high level doctors and physical therapists the same way. It's also filled with people of very high integrity, people who are especially smart, people who are especially dedicated to public service and to serving the public and patients, because otherwise, why would they do it? I know it's thankless. You guys don't get paid for what you do. But there is a way in which the incompetence piece is there, and it's sort of twofold. One is the professional members of boards, because the statutes require them to be full-time working license holders, are extremely busy and not particularly trained in regulation, how regulation works, what are the benefits, cost-benefit analysis, trade-offs. You come into this job with almost no training in what it is you're going to be doing, because what you're doing is not physical therapy. What you're doing is the regulation of physical therapy. The other way in which we might use the word incompetence is this idea of conflicts of interest. And I mean this not in a very literal way, like you oversee a disciplinary hearing for your buddy. I mean the kind of attitudinal conflict of interest that kind of inevitably comes from spending profession. And then in the case of a board member, usually a lot of that professional life in a professional association. Is there a way in which what's good for the profession does not always line up with what's good for the patients? I'll use patients here because that's what you guys have, but consumers would be a more general term. And in my opinion, yes. In my opinion, there are significant conflicts of those interests such that the way that we do this regulation maybe ought to be changed. Now, that's not what this presentation is about, because this is the way that we do regulation. It's the way you do regulation. And I want to help you identify some of the more problematic areas of this sort of attitudinal conflict of interest, how you can think about it, how you can mitigate it. And I also want to give you a little bit of an outside pair of eyes, what it's like for somebody like me to sit in on a board meeting and hear the conversations that happen, to give yourself a little bit of self-awareness about how the public, or even somebody who cares about competition who's not inside the profession, might hear the things that you're talking about. Okay, so I got to know all these board members, and everyone said the same thing. They said, okay, you know, true, I can see how public protection and what's good for the profession don't always line up, but I can always change my hat. That's what I do. I change hats. And so there's a little tension in my presentation, because I want to say I don't think it's totally possible to change your hat. I don't think it's possible to shed your professional identity. But I'm also giving a presentation about how to do it and how to do it better. So let's talk a little bit about the hat to be changed, okay? The hat to be changed is the hat that you wear when you advocate for your profession. Now, most of the board members that I have met have been very involved in their professional associations. They've often been past presidents, you know, in leadership. And this is inevitable in some ways. Like I said, board work is thankless. You don't get paid. So guess what? You're going to be looking for people who are respected in their profession, are altruistic, and either have time or somehow make time for service. That's somebody who's involved in their professional association. And they're just sort of well known and prominent, and it's easy for the government. Okay, we'll get this guy from a professional association. So to better understand how these conflicting interests might play out, let's think about what professions want for themselves, and therefore what professional associations want. And I realize this is a subset of what associations do, and I don't want to imply that I have an impoverished view of what associations do in their work. But a part of their work is to make the conditions of their profession and the professionals in it better. Okay, and by the way, I include myself in this set of goals. Everyone wants these things from their work, right? What do we want? We want to be autonomous. We want to set the terms of our own profession for itself. We don't want to be told what to do by a doctor, by a lawyer, I guess. I'm a lawyer, so I'm all for it, right? It depends on where you are in the pecking order. But you want some sort of self-determination. You don't want government, for example, telling you how to do physical therapy. You want the physical therapy profession for itself to determine those things at the professional level as well as at the individual level. You want personal autonomy in your profession. You want pay. We don't want to do this for free, okay? And we should be paid. And I guess the more the better. Like that. I mean, that's not obviously anybody's attitude, but everybody in their profession is doing something really important, contributing to society, making people healthier, making people safer. It's the kind of thing that should be paid, and everybody wants to be paid well for it. You want public esteem. You want the public to respect you, to think with what you do is important, to regard you as a fully professionalized entity. This is more important for some professions than others. Medicine doesn't struggle with this because they're sort of the definition of a profession. Other professions, there's a sense that we need to be seen as a profession. Okay, and finally, fairness. Fairness has a lot to do with other professions sometimes. It's not fair, and this also comes to autonomy, that I'm under the thumb of a doctor, of some other kind of higher level profession, right? I can't, as a family counselor, I can't do the same kind of therapy that a PhD psychologist can do, and yet I do the same thing every day, and day in and day out. I talk to people about their problems. I'm there for them. I help them. I'm really good at what I do. What I do is just as important. And in some cases, I go through the same level of educational training. It's not fair that I don't get the same, professional rewards. That would be one version of fairness that we all care about. Okay, now do these sort of self-interested goals of a profession line up with public protection? And the answer is yes, of course they do. So if you get too much into the weeds of how a profession does its work, whether you're the government or you're a different profession, you're going to screw it up. So autonomy can really benefit the public. The pay can benefit the public. The more you pay, the more you attract high quality providers, the happier and we can include in pay kind of the idea of like lifestyle and convenience, maybe, like the rewards you get from your job. That's going to reduce burnout. It's just going to make for happier patients. Public esteem is great for public protection because if the public believes in what you're doing, then they're probably going to have a better experience of it. And fairness can also protect the public. The last two are a little bit hard to tell a story of exactly how they protect the public, but certainly if the unfair thing we're talking about is two different professions, each with the same kind of training and rigor, and one can do something and the other can't, that's unfair. And allowing them both to do it would be good for the consumer by having a choice and by being able to have access to a whole other provider. So there's plenty of examples where the professional interests that we might associate with an association can line up with public protection. But there are also lots of trade-offs. I think I'd prefer to get into these when I talk about the specific examples, but I'll run through them quickly. So autonomy for a profession is not good for the public, where perhaps you do need supervision, right? A nurse shouldn't be able to do everything a doctor can do and determine for herself or himself exactly how to do their work if that's not what's safe for the public. Pay is a really big one. The more you get paid, the more expensive the service is, the fewer people can provide it. That raises prices, that reduces access to it, and it also can restrict the variety of ways of delivering the service. Public esteem sounds great for public protection, but if we achieve that by making the profession more and more professionalized, higher and higher degrees and more requirements, so they become, sort of like in that doctor level, then you're going to see a lot of trade-offs in terms of ability to pay and access to services. Fairness sort of almost has nothing to do with public protection, again, unless it has to do with questions of autonomy and pay and public esteem. Okay, so this is the slide that I have to represent the idea that board members who are ingrained in this kind of space feel themselves pulled. I hope they feel themselves pulled. I think the worst thing is when you don't feel yourself pulled. You don't even really see or understand those conflicts. And maybe that's what this presentation can help with. They are pulled in two different directions in the way that they make their decisions. So, can we solve this problem with public members? Well, I don't know. I know there's probably a lot of public members on this call, and this is not you, but I have observed a lot of public members, I think for very good reasons, not being particularly engaged in the decisions. They're not picked because they have any particular interest or expertise in that profession. They feel intimidated and kind of outnumbered by the experts. A lot of times they don't really understand the decision because it's about a profession that they don't know about. And they kind of sit back. Some of them that I have met have been like totally disengaged, like on their phone. Many have been just sort of quiet. And then a few have actually been pretty outspoken and really very, very helpful. The one I talked to about with the Napoleon quote was one of these. Very, very helpful to their board. And so if you're out there and you're a public member, I urge you to listen carefully to this presentation and do your job with confidence. The other thing I'll say is that all the professional board members I've talked to about public members say that they really appreciate and respect the public perspective. So your perspective is valued on the board. So don't be like this guy in this meeting. And the quote that I heard when I was at the boards that I think sums up this phenomenon is the chairman, actually, of a board said this. He's a public member. I definitely have my opinion, but I think I should back up and let it hang on the experts. And he never said what he thought. So I don't think public members are an adequate check against the conflicts of interest, but I think that they can do more, and they should. Okay, so how do associations kind of unpack these various goals that they have? One is that they want more education and higher entry barriers. Why is that? So that's sort of symbolized by this image here. Well, the more you know and the more expert you are in your profession, the more you can justify the idea that we don't have to be under anybody's thumb. We can determine for ourselves what we do. This is like, we think about doctors and lawyers especially, this kind of this prestige mystique of very, very highly educated people. Okay, we're not going to, you know, take any cues from anyone else. The more you throw up barriers to entry to your profession, the fewer people will do it. The fewer people who do it, the higher prices you can pay. So this may create a higher pay situation. I think you'll also find that people see you as more professionalized. They hold you in higher esteem. Oh, you have a doctorate. I think this is a thing in PT. Recently, the standard was from master's to doctorate. And I'm sure it varies state by state, but that might even entitle you to call yourself a doctor in some capacity, right? Like Dr. Allensworth, if I had a PhD, which I don't, so I'm not a doctor in any capacity. But that is really valuable to a profession and to a professional. And I admit, I like being called professor. I like the prestige and the sort of social benefits that come from being highly trying to throw any stones in a glass house here. And of course, fairness. Well, you know, there's plenty of barriers to entry from this other profession. We should have the same barriers in ours. All right, does it in order to public protection? Of course it does. The more you know, the more education you have, the more barriers you have to entry, the higher quality provider theoretically you will have. Are there trade-offs? Really big ones. And not just to consumers, also to the workforce who want to have access to the profession, who now can't because the barriers have gotten so high. So I have a little case study to illustrate this particular phenomenon. It comes from a board in my state that licenses alcohol and drug abuse counselors. And they had a rule in 2015. Prior to 2015, the rule was if you had 270 hours of counseling-related courses and a bachelor's degree in anything, you could go into the profession. And so you could do your 270 hours as a part of your bachelor's degree in counseling, maybe, or you could get a bachelor's degree in underwater basket weaving and then go back to school, do your 270 hours of counseling and become a counselor. They changed the rule in 2015 to require that your degree actually be in a counseling-related major. So it's puzzling to me how this would add to public protection. If you've had the 270 hours, you've had them. Why does it matter where and when you did them? And also, drug and alcohol abuse counselors were meant to be a sort of quasi-professionalized small step up from like AA sponsors, right? So people who were looking for second careers and helping people overcome addiction as they had. And they wanted some sort of training and some sort of license because, of course, this is extremely important, extremely safety-sensitive work, but not something that would rise to the level of psychologist or psychiatrist because there was such a desperate need for drug and alcohol abuse counselors. This came in the 90s when not addiction, but demand for addiction treatment exploded because some stigma was removed. And so there was this movement to really bring more people into this field. Started out at 1,500 hours of, this is a different requirement, right? But I'm just showing you how it changes over time. The profession started at 100 hours of practical experience, went to 3,000, now it's 6,000. 2015, they changed this rule from get your 270 hours anywhere to you've got to have it as a major. They tried to roll it back, they being the state and the staff, and the board pushed hard against it. And I'm just going to share with you a few quotes from those debates that I heard that, hearing from somebody of my perspective, made me think that they were not thinking about the public, they were thinking about something else. Okay, I have a lot here because there was a lot of hearing, a lot of good quotes, but we want to be considered as strong as any other license that's out there for counselors. So they're looking for parity and fairness with psychologists, psychiatrists. We need to keep our license robust, otherwise the less payers will reimburse us for our services and the less respect we'll get in our community. I'm concerned about pay for counselors in the trenches. If you flood the market, you will lower the pay, and that's how you get low quality practitioners. And you see here the pivot from pay to public protection. Yes, there's some thread there. I see it. But it's not a particularly convincing argument about quality. Tell me more about why the 270 hours needs to be a part of a major. Okay, I want to protect what we've got. When you open the door, you let the bugs fly in. And it's our responsibility to make sure we are looking out for this profession. Respectfully, I would say, no, it's not. It is your responsibility to make sure we are looking out for the public. And I know some of these quotes seem to go kind of far, and you're thinking, well, my board would never do this. Or, you know, I really have a problem in Tennessee. I sat through hours and hours and hours and hours and hours of meetings. And I'm cherry picking. I'm picking the worst cases. And that's because they vividly illustrate something that I saw in a small way every single day. So maybe you're not going to say this exact thing, but I saw in every meeting some sense that I was sitting at an association meeting. These are just particularly vivid examples of that. Okay, this I have too many quotes here, but anyway, there it is. Okay, goal number 2. So the first goal was strong entry requirements, including education. Goal number 2 is to have broad and exclusive turf. I'm not going to go through each of these individually anymore, but turf contributes to professional autonomy. It'll help pay by limiting competition within that turf. It contributes to the public esteem, and it contributes to fairness. Let me practice to the full extent of my training. You can. Why can't? Does it serve the public? It serves the public if the turf is defined according to competency. I don't think it's wrong that doctors can't, do my taxes or something. That's not a turf problem to me. But I do think that if it's about something else, it doesn't serve the public, because overlapping turf is a great thing for the public. I believe that the public is better off if they're able to choose 2 different professions for the same service if both professions are competent to do it. Doctors and nurses, of course, are my classic case study for turf issues. We have nurse practitioners that are supervised by doctors, and in so doing, they can do some primary care and prescribing in my state. Supervision was recently euphemistically changed in the statutes to collaboration. And when this happened, the medical board engaged in a rules revision where they had to decide how they were going to change what supervision or collaboration meant. Prior to this, there were no caps on how many nurses you could supervise, and the board proposed limiting that to 4. This is a tremendous restriction on supply. So as it was in Tennessee, it was hard if you were a nurse practitioner to find a doctor who would supervise you. In fact, nurses paid doctors sometimes thousands of dollars a month to do the very limited work of reviewing their charts and visiting every 30 days or something. Now you're going to take that and you're going to say you can only supervise 4. Now, this is a response on the part of the medical board to a very real problem, which is pill mills. I'll get to later. But there were all kinds of totally crazy pill mills going on where you had 50 nurse practitioners, 1 doctor. He was totally out to lunch. He couldn't possibly meaningfully supervise 50 nurse practitioners. And there's this like total scam going on. So I'm sympathetic to it. But here's where I'm seeing one hand on the other hand, right? On the one hand, we want to have adequate supervision. On the other hand, we don't want to restrict supply. But the board only sees the one hand. They only see this one hand. What's the other hand? Restricting supply. Well, it's COVID. So we only had about 6 weeks between this hearing and when coronavirus hit the US and hit New York hard. And this is the proportion of doctors, I believe, some kind of healthcare worker to the population. And you can see that we are obviously way below Austria and stuff. But look down, we're actually worse off than Italy by quite a bit. And the real problem when COVID hit was not that we didn't have enough ventilators, it's that we didn't have enough providers. And in fact, nurse practitioners and other mid-levels are very important in the fight against COVID because they can man those ventilators. So this is just, obviously, I can't blame the board for not knowing COVID was coming, but I can say that healthcare provider shortages can have really dramatic effects to public health. And that discussion just wasn't on the table. Instead, this is what they talked about. If you want to be a doctor, go to medical school. That's what one doctor told me about nurse practitioners. Okay, fine. I mean, I get it, right? Like, this is your profession. This is your turf. This is your autonomy. This is your social status. You're not a doctor. Okay. Then nurse practitioners have a very aggressive lobby. It's hard to compete. So they were framing the decision in terms of a competition between the nurses. And then finally, they had the idea, well, let's get the pediatricians to lobby for it because they have the lobbying power. If we frame it in terms of children, it will be harder for them to dispute. By the way, they, for various reasons, dropped this idea of limiting, I mean, basically COVID, dropping the idea of limiting it to 4, at least for now. So we'll see what they do with that. Okay, another turf example, and I want to check my time. I don't want to bore you guys going on too long. Architects and engineers. In fact, you know what? I think I might skip this one. Well, I'll do it quickly. So term protection. I know term protection might be an idea, a notion that's very near and dear to physical therapists' heart. For architects and engineers in my state, you can call yourself a sandwich architect or a software engineer, but you can't use the word in a way that creates confusion as to whether or not you're licensed if you're unlicensed. And that's a huge gray area. And they had all these cases about people calling themselves building engineers. Okay, it was the term. And the whole debate was about how does this threaten kind of the contours of our profession. And one board member said, if we want to pick this battle, we need a game plan. Battle mentality, I think that really kind of put this over the edge of, doesn't seem like we're talking about confusion on the part of the public about whether or not a building engineer is licensed. Finally, the last goal of an association, and associations seem, correct me if I'm wrong, maybe it's different in PT, but they seem to focus a lot on rules and not so much on discipline. But I still think that there's an interest in the association and the professionals to have optimal discipline for the profession. So what is that? Well, sometimes it's a slap on the wrist. Sometimes it's going to be going really harsh. The key seems to be, is the person who's being disciplined within the profession or not? Optimal discipline may go to these goals as well. Does it serve the public? If we are too light on bad providers, on scary providers, on unethical providers, that is not good for the public. But I've also heard a lot of providers justify light discipline on the idea that it keeps people and thereby doesn't constrain access to the service. So I guess not throwing the book at everyone is good for public protection. But certainly if you go too light, there are some risks. Is going too hard on unlicensed practice? This is the sort of dichotomy that I saw. Is that if you're disciplining somebody who is within your fold, you're going very easy. If you're disciplining somebody who's unlicensed or encroaching on your turf, you go very harsh. Is that good for consumers? Well, it is if the person who's unlicensed is, if licensing is important and good for the public, which obviously most of us here think it's true, then an unlicensed practice is potentially unsafe. If it's a close call, Is this really the installation of alarms? Is this really, auctioneering? These are the two examples I'm about to talk about. Maybe not so much. So check it out. I did a little very light empirical work on 2 boards in my state, and I learned a few things about how they did discipline. Auctioneers dismissed 80% of consumer complaints, including a lot of things that people told me were the reasons why we have licensing for auctioneers. So among these things were shill bidding, fraudulent descriptions of items, absconding with proceeds. One alleged a child was serving as an auctioneer. These are the parade of horribles, maybe not the child thing, but that people tell me when I ask them, do we need licensing for auctioneers? Well, if that's the case, why aren't we able to go after isn't this important work that the Auctioneer Commission should be doing? And of course, we know that consumers complain of all kinds of crazy things, and it's not like I'm expecting, 90% of consumer complaints to run to ground. But what was so stark was how harshly they went after the unlicensed practice. So 20% of consumer complaints, the most they did was a letter of warning. Oh, but if you did unlicensed practice, you got a fine, you got a penalty. That was not a letter of warning. They just totally threw the book at you. And then alarm system installers had some very similar data. So they took action in 17% of consumer complaints, whereas 60% of competitor complaints, and they were 10 times more likely to act on an unlicensed complaint than ones that were about safety, quality, and fraud. And again, these were the kinds of complaints that people told me when I asked, why do you need licensing for alarm installers? They said, scams, people coming after old people and making them scared, stuff like that. And that's what these safety, quality, and fraud claims were about, and yet they really didn't act. So if you put a third hat on, the Professor Allensworth hat, and you look at this pattern of discipline, you're thinking, is this board really here for the public, or is this board here for the profession? Okay, this is a long thing, and I don't know if I really want to do the whole thing, so let's see if I can do this quickly. So I came into this research starting with doctors, because I thought it was really interesting that everybody gave doctors a free pass. It was like, well, maybe you want to criticize licensing or whatever, but obviously we have to license doctors, and obviously doctor boards are fine. They're not fine. I do think we need to license doctoring, but the way that we do, medicine, the way that we do it with the self-regulation is extremely problematic. And I've already alluded to one of those with the supervision and the rules stuff, but discipline. My goodness, it is extremely hard, apparently, for a medical board to truly throw the book at any doctor, even for very, very extreme behavior. So I ended up picking one case, but I could have picked one of maybe 12 that I actually personally saw, about a doctor who was put on probation for dealing prescription drugs in 2014. And while he was on probation, he formed a scheme with another doctor on probation where they would forge prescriptions for opioids and benzodiazepines, Suboxone actually, which is an opioid technically, and benzodiazepines, sell them for $300 cash. They took federal felonies for that. So this particular doctor had, at the time that I encountered him, 2 different criminal, one no contest, one a conviction for using his license to deal drugs, once while on probation from the board. And they reinstated his license and put him on lighter probation than he was on when he committed the latest crime. Also, in the course of my research, I learned that he had been denied licensure in 2 states as a young doctor for an inappropriate relationship with a 16-year-old inpatient psych patient, sort of a personal relationship. He kept calling her after she was dismissed. He was denied licensure in 2 states over that, and that he was known in Knox County for being the ER doctor you could take a suspected drug dealer to have an involuntary and unwarranted body cavity search done. So he would paralyze suspected drug dealers medically and attempt to, or in some cases, pull drugs out of their rectum once those drugs were used to convict somebody who appealed on Fourth Amendment grounds won. So you have a Sixth Circuit case saying that Dr. LaPaglia's medical practice basically shocked. Then you have him found plead no contest to drug dealing charges in the state. Then you have him appear in front of the board. Then you have him start a new drug dealing and fraud scheme. And then you have the board giving him back his license. How did this happen? Well, if you're really interested, I have a whole article about it that I wrote in the New York Review of Books. But the short answer is that self-regulation creates some very bad incentives when we're talking about discipline. You want to protect the investment. I had a doctor on the board tell me it takes $1.5 million of public funds to train the doctor. If you had a $1.5 million piece of equipment with a broken belt, would you dump it in a ditch? Is that for public protection? Yeah, it is. That's what he would say, because doctors is a shortage of providers. Remember that chart I showed you that made us so vulnerable to surges of COVID cases? So, but you can see how that can go too far, and in this case did. There was also an attitude of like, let the criminal law do it. This guy's a criminal, like let the criminal law deal with it. And we're not going to pile on. This guy's done his time. He's paid his price, and he's already so in such a difficult position. He's not going to really be hired. His career is nothing what it used to be. We don't want to pile on by taking his license. And yet you see how that's not a public regarding decision. So this is about a different case, by the way. This is a board member talking about this issue, but as to do with yet a different federal felon getting his license back. Okay, find the good in everyone. Now this I understand really well, and this was the most heartbreaking part of this. This person gets up in front of you. They've been through the same professional school as you. Maybe they've done some of the same kinds of jobs. And you want to give them a second chance. And I completely understand that. And I completely think that that's human nature, and actually may particularly be present in doctors and other people in the healthcare field, like physical therapists. This is what the board member said in reinstating his license. Hopefully I'm a decent judge of somebody's heart. I saw someone that cares. Another thing I'll say about this quote is it doesn't just stand for the idea of finding the good, but it stands for something I want to tell you that I don't know if this is a problem in physical therapy, but when you sit on that board, you're a judge and in these discipline cases, and judges believe that the people standing in front of them lie to them. And it's your job to figure out if they're lying. And I don't mean by reading the tells or whatever, that doesn't work. But don't assume that everyone somebody tells you in a hearing is correct. Read the materials that are given you. Try to, do some due diligence in understanding the full truth, because judges know that not everybody who stands up and says XYZ, that does not mean that XYZ is true. Okay. Now, that's basically my presentation. So those are the three main goals of associations. That's how, from my perspective, they can sometimes be consonant with public protection, but they can also be dissonant. I wanted to leave you with two final thoughts. One is, how should you deal with your association? This I actually think is pretty easy. This is the easy part. So you should resign, okay? It's not required in Tennessee that you step down from leadership positions, but most people do, and you should absolutely do this. They'll let you back on. They'll let you back on with open arms. But being a part of an organization that protects the profession while you have the mandate of protecting the public is not good. It's just not good. Okay. Don't take any private meetings with the association. I have a fancy word for this because I'm a lawyer, which is ex parte. Make them say what they're going to say in the meeting, on the record. And I think that association perspective in board making is really important. And they are very expert. They have a lot of information, and they have a lot of constituencies that, are going to be affected by these rules. And so you're going to want to hear from them. But there's no reason why that can't be done in public. And I think you should think of it as one perspective on a problem with lots of different interested people, and really should be thinking about the public. One thing I saw actually the PT board in Tennessee do was they tried to, and the public member stopped them. Good for her. Oh, we need to revise our rules, or even worse. Oh, hi, I'm a member of the Public Therapy Association, and we've rewritten your rules. Just clean them up, just made them a little bit more coherent. And you know, we're offering these to you for your editing and your approval. Another way this happens is the board wants to make a rule change or rewrite their rules in some way, and so they create a task force that's basically the association, and then maybe with one member from the board on there. Now, of course, anything that task force does or the association does would need to be ratified by the board for it to be law, but it shouldn't be that cozy. Let's let the board take input from the association, take advocacy, take their position, but actually do the drafting and the hard work, frankly, time-consuming work of figuring out what it is that you want your rules to say for the benefit of the public. The association is not your constituency. Don't call them that in meetings. Don't think of them that way. And in fact, maybe this one goes too far, but maybe when there's a close call, something that seems like really on the line of whether or not, you know, your statute allows chiropractors to use the word physiotherapy, and it's kind of a new issue, and you know it's on the line, and the association is asking you to say no, they can't. Maybe rule against the association in those close calls. That would be the most kind of conservative thing to do. Lastly, if you are interested in kind of the low-hanging fruit, the things you can do to open up licensing to different kinds of workers, to increase access to it, that don't, in my mind, really conflict with the associational goals, go for these things. Okay, increase portability among states. That is a huge benefit to providers, and it's a huge benefit to consumers. That is a win-win. Not always done in a way that's a win-win, but it could be. Admit ex-offenders. Okay, I know I'm all down on the doctor who's an offender. Okay, but that's an example of him using his license, really using his license. Somebody who's done some time, I don't see the harm in letting him in to your profession. I don't think it makes your profession look bad. I don't think it really endangers patients. And the barrier that ex-offenders face to the professional world is really significant. It increases recidivism by having these barriers. It increases crime. So this is a big one, and I think it's not quite a win-win as the increased portability is, but it's kind of a win, and so you should do it. Okay, reform discipline. I would like to see a thumb on the scale when you hear these cases about like, okay, I know this is somebody from outside my profession, but I'm going to try to, you know, not react as negatively as maybe my first impulse is. And then when it comes to somebody within the profession, try, if you can, again, here's where I'm a little bit cynical about whether or not this can happen, but try to set aside that identification that you might have with that person. And then finally, there's this other thing I've noticed, and I'm speaking especially to your organization, the Federation. I think federations are awesome and really important because one of the problems with boards is that they don't have the economies of scale to get the regulatory expertise going, and federations are great for that. One problem I have with federations is that they tend to push the licensing policy up to the highest state. So you go to these meetings and you learn, oh, wait, Kansas, we're the only state that doesn't require our physical therapist to XYZ. Or, hey, Kansas is requiring, you know, an extra exam or something. And you learn about these other states doing things, and it's like, you got to ratchet that up. What if we thought about this the other way? What if we thought, oh, Kansas doesn't require what we require, or, you know, whatever. Doesn't seem like a lot of people are, you know, having major injuries as a result of physical therapy there or whatever. Maybe the state that's doing the licensing in the most low-key way, where there isn't evidence of public harm, maybe they're the one that's doing it right. Okay, that's my food for thought. Oh, I went longer than I thought I was going to go. I'm going to go shorter than 45 minutes, but it looks like I'm just slightly past. So I look forward to your questions, and thank you for spending your time with me today.
Well, thank you very much, Rebecca. Before we read the questions, I just want to remind everyone, and I'm sending it in the chat to everybody that if you're interested in any of our future annual meeting webinar series presentations, you can go to www.fsbpt.org/2020 webinars. So the first question we have is from Tom Pennington. What are best practices to minimize and prevent professional bias over public protection, knowing that most PT boards are stacked with physical therapists?
Best practices. Okay, well, I guess I kind of thought that was sort of where I was trying to go at the very end of the presentation by talking about, can you, in your mind, put your thumb on the scale against creepy providers, which I know may not be quite the issue that it is in the medical context, but I think is also an issue in physical therapists. Abusive providers, incompetent providers, and try to minimize that thought that you might have about, like, well, think about all the work he put into that. I mean, think about all the student loans he got for his, right? Don't think of that. Think of his victims. Think of the way in which your profession will be tarnished. Okay, and quitting your association, not taking all the stuff I said about how to deal with your associations, I would say that's best practices. Go to your federation. I mean, I explained my qualms about federations too, but maybe you could start a task force to look at everyone's, regulations and pick the one that's lowest. Try some kind of new, like, anti-licensing reform. What else? You might admit ex-offenders, portability. Oh, public members. Really encouraging. So another thing that actually I have in my article is one of the board members said to me, he was a public member of the medical board who did the LaPaglia doctor thing. I was pulled aside by a professional member early on and told, always save a doctor when you can. Don't do that to your public members. And if you're a public member, don't stand for that. Value your public members, encourage, let them know that you value their perspective. Because they've probably all been to PT and, they do have a patient's perspective and they also just have a common sense perspective that sometimes the experts lack. So yeah, I would say those are the best practices.
Great. This next question is from Nancy Kirsch. Do you think the regulatory board should take a role in prevention of bad actors, or is that the role of the professional association?
I think the board should. I mean, I guess I think the association should too. Do you mean bad actors like an unethical doctor? Or I guess I can't really ask for a clarifying point to this question, but there's two different ways to think about a bad actor. Like a board member who's acting improperly. I guess you probably can't mean that. Okay, so to the extent that somebody who is doing a bad actor, somebody who is a physical therapist who's abusing his license, who's abusing his patients, who's doing something like that, I think everybody in the profession and the board has a responsibility to make that known. This is not criminal law, right? This is not like beyond a reasonable doubt. This is patient protection. And so I don't really know how associations discipline members like that. There probably isn't a formal disciplinary thing, but I would turn a pretty skeptical. I would be very unhappy with an association, for example, who learned of something like this and didn't. It's short-sighted because having abusive providers in your profession makes your profession look bad.
Okay, here's the next question from Missy Anthony. And Missy, I'm going to slightly summarize your question. In essence, we don't have a lot of applicants who have a criminal history, primarily because they're being screened out by the admissions policies of the entry-level educational programs. What research has been done on admission policies as a barrier to employment for people with a criminal past?
I don't know of any. That's really interesting. There's a small but important set of research about at the board level, at the licensing level. I don't know of any about admission to school. I would say that one thing that maybe is within your power is to educate the schools on the boards and the profession's view of ex-offenders. So they may be doing this because they believe that you'll never get a license, like, oh, the board will never license somebody who has a burglary or something like that. And that's wrong. It wouldn't surprise me if there was some benefits here to like having a liberal and sort of articulated policy on ex-offenders and then sharing that with the schools. Because the schools should want to let them in. I mean, it's just money to them, right? Like, what do they care? Unless they're worried that this guy's going to reoffend, like against one of their other students. I can't imagine, guy or girl, I can't imagine that's what they're really worried about. So it'd be an opportunity for some education there.
Okay, this next question is from Cindy Potter. With the race to the bottom, what types of evidence are most useful to demonstrate a need to change laws or regulations? Any sources of data?
Wait, say that again. So for the race to the bottom.
With the race to the bottom, what types of evidence are most useful to demonstrate a need to change laws or regulations? So potentially either strengthen them or make them less restrictive.
So this is really hard. We would all love to make data-based decisions, right? We would want to know health outcomes in different states based on licensing requirements. So if we, if half the states went to a master's degree, studied in a master's degree, and half went to could we evaluate the actual effect on patients in those states? And I think the answer is that in a lot of cases, this is not going to be present, which is another reason why I think the licensing board system we have now is inefficient, is because you don't have the economies of scale to really gather that kind of data. But some economists have done studies on things like the effect of strong supervision rules on nurses in patient outcome, like child maternal health and like some other measures that you might use to see primary care. And they found that at least having strong supervision rules does not increase the outcomes of having better primary care. So yeah, abstractly, the answer to your question is patient outcomes. In reality, something we need to study better, I guess. I mean, I would say if there's a state that has a lower set of requirements and they're not inundated or really even seem to have more disciplinary cases with scary stories or whatever, like maybe it's the absence of bad outcomes that tells us that the lower level of regulation is appropriate.
And one comment that came in was looking at some of the right touch regulation work that's coming from the UK and Australia. Our next question is from Joni Callis. What are your thoughts about how names for open board positions get recommended to the governor's office? Often the professional association does this. How can this be reformed, or should it even be reformed?
I mean, the association to board pipeline, as I call it, is kind of inevitable. I do think it's bad because it really contributes to that. So now you have somebody who's not only like really expert in their profession, but also has dedicated a lot of their professional life to the interests of the profession. And I do think it's kind of inevitable because the governor doesn't know enough physical therapists to put them on his board, and how's he going to find, he or she, how's she going to find people to serve when it is kind of thankless? So yeah, I mean, I think it's bad, but I don't know how to reform it. I mean, I think if you're going to have the professional dominance, if you're going to have to find professionals to serve, what I would do if I were a governor is I would use the public member seats for like actual patient advocates, like people who had some, advocacy experience in dealing with patient advocacy, not just somebody who's been to PT. And I see an interesting question here from Brangelman, Mr. Brangelman. So what can you do that isn't about changing the law and changing board membership? And I think that's where I really want to hit home 2 points. The concrete stuff at the end of the presentation, how to deal with your association and the low-hanging fruit. But then also this attitudinal thing is to check yourself. Think, am I talking like those quotes Professor Allensworth put up? Am I talking about my profession? And not just talking, but thinking, right? Am I thinking about patients? Always be thinking about the patients. It is not your responsibility to protect the profession. It's your responsibility to protect the patient. And patients want safe practice, but they also want choice. They also want access. They also want it to be affordable. Those are all very important things to patients.
Okay, before I read our next question, we had a comment regarding the screening that schools are doing for criminal record checks. And the rationale in many cases is because of clinical rotations that the clinical facilities that the students are being placed at require a clear background check to accept the students. So the program just won't admit somebody that will have a problem getting a clinical placement. This next question is from Kathy Arney. Do you have suggested best practices in providing board members information to review when considering scope of practice questions and balancing public protection and safety with education, training, and competence?
I would love to follow up with that. I'm actually tempted to show you this thing that I have not yet read, okay? So I'm sharing this with a caveat. It says, questions a legislator should ask. And my understanding is that this is about like the things that it's Clear. I don't know if you guys are familiar with Clear. I really like Clear. They're kind of not a board of boards like you guys, but they're a board of all regulatory concepts. Okay, so Clear has published this questions a regulator should ask, 3rd edition by Kara Schmidt, PhD. Okay, it's for legislators, but that's you now, right? That's kind of you. I know you're not a legislator, but you are a lawmaker. And so some of the stuff is going to be irrelevant, like should you license this profession? But a lot of it is going to be about, I see stuff in here about scope of practice. So I would use things like, especially Clear. Clear is a really good organization that talks about what is the goal of regulation and how can you achieve it in a way that is still appropriate for consumers.
And we're almost out of time, but I will say for any member of the Federation who's been to our regulatory training, obviously, I can't remember if it's that book or one of the other Clear resources that we typically share with people coming to the regulatory training, because Clear does have a lot of great resources for members of regulatory boards. So unfortunately, we have hit 4 o'clock. If you had sent a question, I'm sorry that we did not get a chance to address your question. And the book was by Ben Schimberg, is the book that I'm referring to from Clear also. So we just want to, once again, thank Rebecca for this very fascinating presentation. I know that I'm sure everyone enjoyed it as much as I did. And once again, if you're interested in any of our future annual meeting webinar series presentations, please go visit the website and we'll have information, and then when registration opens, there'll be a link for you to actually register for the session. So thank you very much.
Thank you.
Good, thank you.
Okay, we are back. And so at this point, to see if any board member has any comment, and hopefully each one of you do. Who wants to start?
Tanya McMillan. There were some things that I could relate to in her presentation, and there were other things that I could not relate to in the presentation. I'll start with the one point that she did make, and it was valid. As a public member on this board, when I was appointed, I did come in not fully understanding my role on the board, but having Jason and at the time Katerina available for any questions or concerns, it helped clear some of the smoke. And after the first hearing, it was very clear what my role is as a public member, regardless of if I knew the actual terminology or what. Like, I did learn to lean on the professionals on the board for their input, but I also understood my perspective as a public member as well. And I think as a public member, I've always shared. So that was interesting. So it was very interesting and thought provoking. As you can hear, I'm very challenged right now. So that's my first comment about the presentation.
Thank you, Tanya.
Hi, this is Katerina, a public member. To build on what Tanya mentioned about it being thought-provoking, Rebecca did really well at framing some things for me that I hadn't considered, particularly in regards to the level of sort of strictness that perhaps states may have as a barrier of entry to individuals trying to apply in the profession, and perhaps less restrictions don't necessarily mean less public protection. So that was intriguing for me. So I really appreciate the different perspective.
Thank you, Katerina. Dr. Drummer, Dr. Dominguez?
Madam President, I'm still trying to frame the context of the discussion. There were some things that did not resonate with me, especially along the lines of the admissions process. That's obviously and part of our admissions process. So some inconsistencies, but other than that, still like Tanya, still trying to frame the presentation in my mind.
Thank you. How about you, Dr. Drummer?
Pretty much to a great degree, same. There were a lot of pieces of things that were said that didn't, to me, some of the comments that I feel like a big part of an understanding of really what PT background of PT is to education itself. I don't know if I got hung up on those or challenged with some aspects and trying to wrap the full presentation as well.
I do have another comment, if I may, and I did appreciate the 4 points that she listed: the autonomy, the pay, the public esteem, fairness. So, because I like that framework, and how it gauged the work that we're doing and the profession, like how you look at it. That was good, and I'm gonna say, but when you start a presentation by calling the regulatory field or whatever a cartel, it put me in a defense mode right away. And even with the disclaimer, I was still braced for what was going to come. And so Like I said, I like the 4 points. I like the idea of changing hats. Yeah, walk in somebody else's shoes a day, you know. So if you don't mind, I'm just going to chime in as I'm piecing it together. So I just needed to throw those points in.
I think that's great, Tanya. Keep jumping in. I think from my point of view, it made me feel really good about what we do here on the California board. You know, we can always assess and see where we can do better, but I think I speak for the other licensees on the board that we really do appreciate our public members and the voice that they have and the perspective that they have. You know, you're our balance, you know, because we are in the profession. And so I know there's been times maybe we've gotten into conversations on this board that were pretty heavy in practice, and maybe professional members couldn't quite follow everything. And for that, I think I need to be more aware of, you know, offering to explain or, you know, pull you in a little more so that we can get that balance of opinion. And please always jump in if I ever don't offer that to you. But just want to say that I do, and I think we do really appreciate our public members on this board, as well as, you know, those who might be more involved with the association. I think, you know, maybe I'm biased because I'm on the board, but I see good balance in those members and appreciate it. So I guess that's the biggest thing that I took from this, is that I feel like after watching a presentation like this, we're in a pretty good position.
Hi, Alicia. This is Katerina. I tend to agree with you on that. I think even the fact that we started reading our mission statement at the beginning of every meeting to remind us and sort of set the tone for why we are here to serve today is a reflection of how California sort of prioritizes public protection and understands that that's our mandate as a board.
Mine?
Yep.
So as the administrator of the board, one thing that I can say, and I'll just acknowledge my pro PTBC bias outright up front, how much I appreciate my members, both professional and public, always kind of keeping in their mind the primary directive of public protection. And, you know, with professional regulation kind of always being under attack in this day and age and having to defend it, I'm blessed with the ability to do so because my members, you know, take their mandate very, very seriously, right? So not an activist board, not a protectionist board, very understanding of their perspective of public protection and always considering the consumer's perspective and the patient's perspective. So as the administrator, I think the presenter made a very good kind of point when she said that this is a thankless job. And I can understand that because you guys don't get paid very much. And a lot of this is just commitment to the profession and the policing of the profession. And for that, I would like to thank you. For our facilitator, it looks like we have a raised hand in the comments period. If you could help us address that issue.
Hi, this is the moderator, and typically we don't call on members of the public when they raise their hand. We just get them when we open it up for public comments. So shall we open it up for public comment?
Yes, I think that'd be great. Thank you.
Okay, wonderful. So all right, so the public comment panel is now available. So if you would like to make a public comment, please type, I would like to make a comment, and submit it to all panelists. So please don't type your question, just type, I would like to make a comment, and then we will unmute members of the public in the order that they make their request. And we are displaying instructions for your reference. And to put your hand down, you just click on that icon a second time. All right, so we have a member of the public identified as Matthew Nemiek that would like to make a comment. So Matthew, I'll let you know when you've been unmuted. All right, Matthew, you've been unmuted.
Hi, board. Just real briefly, I apologize. I was trying to get someone's attention. Once you guys went out of the regular meeting and into this presentation, I wanted to bring your attention. The video was running, but the audio was not. And obviously, you guys were able to hear it, but I was able to troubleshoot on my end and identify that there was no audio issue on my end. I actually jumped into another meeting with a similar type of setup and was able to get all the audio fine. And when you guys came back, I was able to hear you. So I'm just bringing that to your attention because it seems like, considering the topic of the information, I thought it would be interesting to hear the presentation. I was able to watch it and read it, but I couldn't hear any of it. And I thought that might be of interest to the public.
Again, this is Jason Kaiser, the administrator. Thank you for the feedback. Constantly throughout the meeting, we're troubleshooting to make sure that both video and audio are going out. I'm not sure in this instance what might have happened, but we were receiving commentary, from sources that we use to troubleshoot that we were kind of broadcasting out. So we'll look into it a little bit further. And this will also be archived on the board's YouTube channel. So if in case you missed it, you can always go back and we'll try to bookmark this part of the video so that you can access it directly.
This is James. If I could be recognized to speak.
Yes, please.
Hi. It was interesting. It was a very interesting and very entertaining, informative to hear this lady's comments, and I have a unique perspective being on the association side. But kind of some comments real quick here. I've been involved in governance activities and legislative and regulatory activities, in addition to the PT board, but other licensing boards here in California. And I really applaud how the PT board of California and the Physical Therapy Association has complemented, but yet not kind of like colluded in any kind of ways. I am very glad of that. The former executive director once said that, he goes, Dr. Sims, if we always agree, we being the PT board and the CPTA, because one of us or both of us is not doing our jobs. And because we have different kind of roles and different kind of missions, separate but kind of involved in each other, it kind of at each other. I looked at the agenda for today regarding the board vacancies, and of the 8 physical therapists listed there, 5 have not sat on the association board, and 3 persons have, the professional members and the ones here since 2006. So we have a good blend there. I think that the association, however, is kind of a training ground. I think that I've learned a lot about how the governance process occurs in California because of my role at CPTA. Just the alphabet soup of acronyms: OAL, Administrative Law Judge, DAG, APA, DCA, B&P, AG, Statute versus Regs, FSA, AGA, AG. I mean, I find it surprising, and I heard the comment about, I forget which public member said that it was kind of a quick learning curve. And so I even think for the professional member who's not involved in governance activities, not a political science kind of sidebar person, I mean, to jump on this board and be up to speed would be very difficult, I think. So I think there's some value in terms of some background with that. And so, yeah. And so the last comment is regarding people's knowledge about PT and at the legislative senate. And I was asked one time by a legislative staffer, do you have to go to school to be a PT? And it's that kind of ignorance at times that people have about what physical therapists do. So I think that at least I try. And I personally have spoke before this board and would sit down and say, James Sims, CPTA, president, director, whatever. And I'd literally get up, walk away, come back to you and say, James Sims, licentiate. I mean, I can wear those 2 hats too, and have to separate that. And that my opinion may not be that of the CPTAs, but me as a licensing or a licensed person here too. So I think that this board, I think, has done a pretty good job in dividing the roles, the different roles of consumer protection versus profession advocacy, and how they can kind of be kind of assist each other in both missions for the various groups, the board of PT Board of California and the California Physical Therapy Association. So thank you.
Thank you, Dr. Sims. And I will echo what you said. As a licensee, I feel very similar to Ms. McMillian coming onto this board and just feeling lost and not really knowing what the board did. And it was a quick learning curve. And I do appreciate Jason and staff and other board members helping me get up to speed as quickly as possible. But I am still learning as well. I'll refer back to the moderator to see if we have any other public comment.
This is the moderator. Thank you, Madam President. And there are no further requests for public comment. Would you like me to close the Q&A panel?
Yes, please. Thank you.
Oh, you're welcome.
And so before we actually leave this agenda item, just want to give either staff or board members a follow-up chance to say anything.
This is Daniel Drummer. Thinking about a little bit more and then hearing some of the other comments. I guess part of my challenge is trying to apply the information to how this board has operated and functioned. And I think that was part of my struggle, is trying to, because I don't see that this board in my 6 years serving so far as having crossed those lines or having gotten to some of the examples that were presented. And so I think that this board has always, all of the members of this board have done a great job of paying attention to the lines and keeping public protection as the mandate. And so I think that was probably the biggest part of my struggle, was trying to sort out, does this fit us? And I struggle with trying to figure out if it does. But the majority of it, I think we've been acting and holding ourselves above the line.
Thank you, Dr. Drummer. Mr. Kaiser, anything?
I'll add to that. And again, I'll just acknowledge my pro-PTDC bias right off the top. I agree. In my tenure as the administrator of this program, I've been very, again, blessed, very thankful to have the board members that I have. I think that this particular training, we do fit into it, but we fit into it as the good examples of the right model, right? And it's always kind of important to kind of find out where you are in the lay of the land, and to kind of take a look around and, hear some of those bad examples and learn what mines not to step on. So that was part of my interest in bringing this particular training to our board members, was just to reinforce and to acknowledge the practices that we already employ.
Thank you.
This board for the past 10 years would not be what it is without you.
Well, thank you, Dr. Drummer. I appreciate that.
We appreciate you very much. Thank you.
Okay, so break time, maybe?
I think that's a good idea.
Let's take a short break. It is 1:56. How about if we come back at 10 after 2? And we'll pick up on agenda item number 12. Okay, thank you. And I'd like to ask for a roll call, please.
Alicia Benaman.
Here.
Katerina Ellaby.
Present.
Jesus Dominguez.
Present.
Daniel Drummer.
I'm here.
Tanya McMillian.
Present.
All members are present and the board has a quorum.
Thank you. Okay, we're going to move into our next few agenda items. And we'll start with number 12, administrative services. I'll just hand it over to Jason Kaiser.
So we'll start with the briefing paper for the budget report and kind of address a comment that was made this morning by Deputy Director Carrie Holmes. Recently, we've gotten a number of new reports generated from the system, from the new fiscal system, that are going to kind of help us find out where we are in as far as reconciling our accounts and making sure everything's on point. With that, though, is still kind of the learning curve of transitioning from our previously formatted reports to what the new reports are generating. And so there are a little bit of issues when it comes to variable A that existed in the old system is now variable D in the new system. And so we are, I wouldn't say struggling. I have to commend staff because it's a difficult task to kind of tackle, because it's kind of like wandering around in a dark cave. It's a new accounting system for the whole state of California, and as you can imagine, for all those different departments and agencies to try and kind of conform their existing accounting systems into this new unit system, that we all don't quite fit. And in not quite fitting, it's going to take us a while to kind of figure it out. What I can say, we're very cognizant of our bottom line budgeting, and we are at this point, still currently seeing expected revenues, even during something as tragic as COVID-19. In comparing the numbers from last year to this year, you'll see that we're still around the same number, and we're not even comparing apples to oranges or apples to apples at this point, because last year's reports were 13, what we call month 13, or the year in its entirety, and we're comparing that number to this year's 11 months. So we still don't have the month of the last month of the fourth quarter in June. But looking at those projections, we're confident that our revenues have not dipped. And then at the same point, we're very much cognizant of keeping track of our spending, especially for a board that's contemplating the move upstairs. And while we've been planning for it for year after year, and putting a little money away for a rainy day, the rainy day is here. And we have had some added expenditures in the project moving upstairs, but to a certain extent, based on, I would say, kind of proactive planning, we're able to manage that and still put a little bit of our projected budget for this year back into the fund. So bottom line budgeting, we're in good shape. Some of that comes from just self-imposed caps on spending, cost savings from vacancies not being filled, those kind of things. But overall, it's really just being kind of hyper-vigilant about keeping our checkbook balanced. So you have in front of you a 3-year expenditure milestone report, which we try to do at the end of every year. Also, the normal budget revenue report, and then also the fund condition is provided to us by DCA. So if you have any questions, please feel free. I'd be happy to answer them to the best of my ability at this point.
What's our budget for temp help?
We don't have a line item budget for temp help. It's something that we've had in the past, but temp help, the expectation is that we are to spend those funds with unencumbered funds from other line items. So other places where you've been able to save money is how you can afford to employ temporary services.
Okay. And so I know in the past we've talked about maybe creating budgets for certain items. Do you foresee that we would want to do that, whether with temp help or any other budget item in here?
It's something that we're always looking at. And so some of the trend data that you'll see for things like board member travel expenses, those are something that we have, we have to collect 3 years of data before we can actually make a change to that particular line item, or at least recommend to our budget office to have that line item amended. This particular display will change in the future because of the new reports that we're receiving from Fiscal. We'll try to keep the kind of the spirit of the formatting per se, so that it's somewhat recognizable to board members. But line items that we are able to kind of isolate here as a specific expense, or even line items that might include 3 or 4 different things in a category, are now different in the fiscal categorization. And so it's going to translate a little bit differently. But one thing that I would, draw to the board members' attention is that in the past, this display used to be riddled with red.
Yes.
It was not a very good true representation of what our spending was. And over time, we made those adjustments to line items to show a more true capture of what the PTBC spending actually was.
Mm-hmm.
And so that's why I say we will constantly do that. So anything that you see in red right now is either expected and anticipated, and we plan on changing it as a 3-year trend item sometime in the future, or it's temporary.
Okay. Any other board member comment on budget or what you see before you in the report?
This is Daniel Drummer. Jason, do we have, is the PTB responsible for the salary of the employee who's working on contact tracing, who's been pulled away for that?
Yes.
Okay.
Entirely so.
Mm-hmm.
And given the circumstances to date, we're lucky only losing one at this point. If demand should arise, there may be, an executive order that requires greater than 5%, and so we may lose another.
Okay.
But yes, we are fiscally responsible while they're participating in that project.
I work for the city and county of San Francisco, and we have several coworkers. I have several coworkers who are in disaster service worker positions right now, and our department budget is responsible for their salaries, even though they're not working in our department. They're working somewhere else in the city.
It hurts a little bit. Don't get me wrong. I mean, managers have to juggle a little bit. Duties have to be kind of shared amongst, the staff that are here. And so there is an additional burden and workload that gets applied to them, even however fractionally it may be, it's still additional. And right now, stepping away from the offices during, COVID-19 and teleworking from home, that just multiplies the effect. So.
I get it.
Yeah. Thank you for the comment.
Other board member comment?
Madam President, I had a quick question for our executive officer. This is Jesus. Jason, remind me, for the staff benefits line item, is that a typical spike in Q3? I honestly can't recall. So $429,799.
I don't know. I would not say typical, but I would say expected, for the circumstances, because staff benefits, there was a very recent negotiation with salary and benefits provided, and that's where the impact actually kicked in.
Got it. Thank you. Makes sense.
I guess I'll just say that I really appreciate the 3-year graph here, if you will call it a graph or table. Really nice to see how each year compares to the other, and when a number might look pretty high, you actually look at the other years and it wasn't so far off for the most part. So thank you staff for putting this together.
To pile onto that a little bit, I'll have to commend staff as well, because we've made a commitment to do this 3-year milestone annually in the Q4 of every board meeting. This year was, because of the transition to fiscal, and not having a consistent reporting tool to rely on made it especially difficult to try to provide this display.
Okay, other board comments? And before we take public comment, we're going to do 12B.
So for the outreach report, again, a very typical report, as members you're familiar with and seeing. Some things that I'd like to highlight just from kind of the administrator's perspective. April Beauchamp, who's still on maternity leave, and she's not with us right now. I think you guys might remember she would be a little depressed in reporting some of these statistics because website travel and those kind of things, or website traffic on our homepage has decreased by a certain percentage, and that bothers her. But I think it's a little to be expected. I think the delivery of information is becoming much more efficient. We're utilizing social media and other tools like Listserv to get information out to our stakeholders with links that, you know, tell an applicant to go straight to the applicant tab, tell a licensee to go straight to the licensee tab, tell a consumer to go straight to the consumer tab. And so having done that, we are going to see a decrease in homepage traffic. And I don't necessarily think that's a bad thing. I think that's just an end product of the strategies that we've been employing. Again, kind of a COVID report for outreach. Because of COVID, we've obviously had to cancel some of our in-person presentations for educational programs and taken a little bit of a hiatus from those, but not completely. So in about the last month or so, we've returned to providing presentations to educational programs, but we're doing it electronically. Most recently to the Gurnick Academy, also Sac State. We have a presentation next week to the University of Pacific. And then we're also taking our show, you know, on the road for the CPTA convention as well. So I think it's just, you know, it's not ideal. We'd very much like to be in person in front of students, you know, future applicants, future licensees, and provide this information, which I think is a, you know, face-to-face, which is a more efficient delivery method. But until then, we will Zoom, we will WebEx, we will Blue Jeans, we will Teams. If they'll have us, we'll accommodate it. So, and we look forward to having April back so she can kind of keep us all in line and I won't have to be so cognizant of my calendar. So, any questions on outreach?
This is Daniel Drummer. Jason, do we have information about the newsletter that gets emailed out? How many people do we reach? And then are we able to track clicks from the newsletter to see that people are, and also if people are opening it?
Sure. The simple answer to your question is yes and no. So we are now becoming very versed in a software package that we've had it for a very long time called Listserv, but it has been updated and it has all kinds of new tools. So I can answer some of your questions very confidently and tell you for some of the others the things that we plan to do. As an example, in our last newsletter, as the newsletter went out, it was actually emailed to every email that we have on file for our licensees and for anybody that has ever signed up for our interested parties list. It was also distributed to educational programs for applicants, posted on social media, posted on our homepage, anywhere we could deliver it, and even having, you know, some of our colleagues kind of help us repost it, whether it's educational programs or even the association. Whether or not they receive it or open it is something that we're working on now inside of Listserv to kind of track that. We can see sometimes, it depends on how it's delivered, right? So it's very easy for me to have metrics on somebody who came to the board's website, opened the newsletter there, and then used the links to kind of go to different areas of the website from inside the newsletter. But when we send it out in an email and they open it from their email box, we lose a little bit of the efficacy of the data. And we're still just trying to kind of work that out and figure out ways to kind of filter it and make it more reportable.
Okay. I know that when I go to a store's website, I will invariably get 4 emails within the next 2 days about why I opened up an email from them, and encouraging, try to encourage me to go back and open, see more emails.
Right.
So if we're able to track who is clicking through, it's just another piece of data about how effective we're being at messaging out to our stakeholders.
Yeah, so with the current listserv package, we're still kind of exploring its potential. Some of the private industry software packages are extremely expensive, and being in government service, kind of have to make do with what we have. But as soon as we master that, we'll look at any other opportunities that might be out there data-wise to capitalize on. In marketing, private industry marketing, that can be, very valuable. I think here it's still valuable, but obviously lesser so, because we don't have profit margins at stake here. But what I do have is just a dissemination of information problem that I'm trying to address.
And off the top of your head, do you know how many are listed in the listserv? How many email addresses we currently have?
Right now, it's just under 30,000.
Awesome.
And that includes both license types. And to our advantage a little bit, we don't do a very good job of clearing out old emails. So some people might be receiving that newsletter in multiple locations based on their email history with our board.
Mm-hmm. And I'm trying to remember, I haven't looked for it, but I'm trying to remember if there's an unsubscribe option at the bottom.
There has been an unsubscribe option on the bottom in the past, and you caught me with a little bit of a grin on my face because the unsubscribe option is no longer available in the listserv. They can always go back.
Oh, that's a shame.
They can always go back to the website, to the mail, the interested parties list, and use the same process to unsubscribe that they used to subscribe.
And since they're required to have an email maintained with the board anyway.
Correct. I'm going to put their name back on the list.
Thank you.
But for those parties that aren't required, that are not licensees, that are potentially consumers or future applicants or something like that, they certainly can subscribe and unsubscribe.
Okay, any other board comment on outreach? Okay, so moderator, if you will please facilitate public comment on agenda items 12A and 12B.
This is the moderator. Thank you, Madam President. The question and answer feature is now available. If you would like to make a public comment, please type, "I would like to make a comment," and send it to all panelists using the field in the lower right-hand corner of your screen. We are displaying instructions for your reference.
This is James Sims, if I can be recognized to speak.
Yes, Dr. Sims.
Yeah. Has there ever been any reports of emails being dropped? I know maybe a couple of that persons feel that they had their emails with the board and then later found out that they were not.
No, but there are a number of different scenarios where an interested party might think that they have their email address on file. And when we research that, we actually go back and find that it was actually never submitted with us. And the email address in particular. So the email address regulation authority is that my licensees have to have or expose their license to us if they have one. And it was never meant as an enforceable regulation per se. Like, no one's ever going to get in trouble for not, telling us their email address. But for us to be able to use it as a communication method and a tool of disseminating information, sometimes the emails are entered into the system incorrectly, and that generates an error which, after 3 errors, essentially removes them from the program. So if there was a misspelling or a mistyping, that could cause something to drop out. And a good portion, well, the majority of the time, since the inception of Breeze, all of our newly licensed folks would have entered that information into the system themselves. So if they're not receiving it, we always encourage them to either submit an address change with the board, go onto their Breeze account and update their email address, or go to the homepage and sign up for the interested parties list.
If they, if a person would renew the license through Breeze, would that automatically put their email on account with the PT board?
That's an excellent question, Dr. Sims, because the answer really is no. So the email address that you use to create your Breeze account is separate from PTBC. That's housed with the Department of Consumer Affairs. We have asked for access to that information, and whether we're going to get it or not is still up in the air. So one, I think what they're researching is whether I'm legally entitled to it, because you could have an email address on file with the board, and then you could have a secondary or tertiary email address that you used for whatever reason, and that's the one you use to create the Breeze account. So they're saying because those two are distinct and separate, they would not provide it to us, potentially. We're still trying to figure that out. But the email that a licensee may, or even an applicant or a consumer might have used to create their Breeze account, I do not have access to currently.
Okay. The other thing is on the outreach thing. I'm disappointed. It is what it is in terms of COVID, but I think there's so much value to the students and any licentiates to get to see and watch what you folks do. And I tried to do what I could in terms of have that occur when I was teaching at universities and other places. So if this, CPTA does anything where they're doing something, maybe an opportunity for outreach for the board, I'm sure, speak for them that they will sure offer that to the PTBC, for that way we can all kind of benefit from that outreach activity, and even starting with exhibiting at the conference coming up here in October. So I just think that there's just it's such an upside. People know what this board does. Thank you.
Thank you for the comment.
This is the moderator, and we have no further requests for public comment. Madam President, would you like me to close the Q&A panel?
Yes, please. Thank you.
You're welcome.
Move to agenda item number 13, application services.
So I'll do my best to represent staff in this particular circumstance. Normally I would like to have them present the fruits of their labor to you directly in the event that they can, but with COVID and our limited ability to do that, again, I'll try my best to represent these briefing papers. So after having had a chance to review these, if you have any questions or there's anything that sticks out to you that you'd like an explanation for, please let me know.
Board member comment? So Jason, can we look at the very first table, initial applications received?
Mm-hmm.
And there's percentages after each cell. And I guess in my mind, I'm always trying to add things up. Yeah.
Yeah, these are not going to add up. So
Right.
they're categorical. So as an example, for the first line item, a total of 1992. Of those 1,992, 96% of them were posted online as a category. 40% of them were from out-of-state applicants. And of the 1,992, 11% of them were foreign, and 2% had a military exemption.
Okay.
Yeah, so they're not going to sum total to the, they are percentage categories from the total to the left.
So 40% of applications received are from out of state?
Yes.
Wow. I knew we had a lot.
We have.
That's a lot.
Yeah.
Okay.
And just to clarify, this is Daniel. The foreign is included in the out of state?
Correct. So
okay.
703 could be both, right? I don't have those numbers broken out for you, but yes, they could fall into multiple categories. As an example, they could be online, out of state, and foreign at the same time.
And military. So, I don't know. Could you be serving in Guam and apply and have that be considered military out of state foreign?
Potentially, I think it could happen.
I have a question. This is James, Dr. Sims.
Dr. Sims, can we wait until public comment?
Oh, I'm sorry.
That's okay. That's all right. We'll get you. Yeah. Okay.
From staff comment, the only thing that I wanted to highlight to the board is just a significant decrease in the receipt of applications in the last quarter of last fiscal year, and that's a result of COVID. I think you can and are all familiar and aware with clinical placements and the delay of graduation dates and that kind of thing. So we readily expect while we saw a decrease in the quarter, we're going to see an increase because it's a slinky effect. And so now as those students are able to get placements and are able to graduate, where they would have come through earlier, they're now going to come through along with all of the other applications that we might be receiving at the same time.
And on the second table, can you tell us what non-accredited PT program, what does that mean? Where is that coming from?
Foreign.
Okay, so that means foreign.
Accredited PT.
Okay.
Anything other than CAPT or PACE.
Okay. Thank you. Any other board comments?
It's good to see pass rates up in most categories on the exam.
I agree. Okay, and so moderator, will you please facilitate public comment?
Yes, so this is the moderator, and I will go ahead and open up the question and answer panel. So if you would like to make a public comment, please type, "I would like to make a comment," and send it to all panelists using the field in the lower right-hand corner of your screen. If you're not seeing the Q&A panel, click on the question mark within a square in the lower right of your screen, and we are displaying instructions for your reference.
Now I think I get to ask a question, maybe? James.
You're on, Dr.
I
Sims.
I apologize for my false start there. We get 2 false starts before I get disqualified. I think there's some labeling that's missing on page 99. Talks about the PT and PTA examination / California, and the accredited PT programs identified. The next 3 don't have labels on them, and I kind of can guess what they probably are. And then on the next page, the first box is missing a labeling also. I'm probably thinking that the first one missing is the non-accredited PT programs. The next one down would be the accredited PTA programs. And then the third one down, third one missing labeling would probably be the non-accredited PTA program. Is that correct? Do you see what
That
I'm?
is correct. So, yeah, I can see it in the materials available because we're having some conversion issues with ADA accessibility. Sometimes when we send the materials over to the webmaster, certain texts are disappearing. So, but you're correct. In fact, we'll make those corrections and repost them to the materials for future reference.
And then on the next page, the first box is missing its label. I'll bet you that is the combined non-accredited.
Non-accredited.
Non-accredited. And then those are all the jurisprudence, the California law jurisprudence are combined PT, PTA. They don't straight up. Okay, they also okay, good. All right, that's it. Thank you, guys.
Thank you, Dr. Kim.
This is a moderator, and we have no further requests for public comment. Madam President, would you like me to close the Q&A panel?
Yes, please. Thank you.
All right, you're welcome.
Okay, agenda item 14, licensing services.
So this one's a little bit more self-explanatory. I'm just kind of reviewing through the tables to make sure that all of the labels are there and proper, and it looks like they are. So again, if you have any questions or any anomalies that you're interested in, I think the data is very consistent from one year to the next. I don't see anything that I would highlight or accentuate or bring to the board's attention. But, you know, I did want to kind of touch on some of the materials that were provided in the report that are kind of new. Staff have kind of tried to capitalize on the information that we have available to us and categorize things. So you'll see in the licensing report things like the top 10 most common counties for licensees to have an address with for the board. And I didn't get a chance to address it in applications, but there's also some categories there. You know, that you can kind of see more specific numbers about how examinations or how applications are provided. So for these purposes, the tables, I think being new, if you have any kind of questions, you know, I'll do my best to try and research or provide an explanation for.
This is Daniel.
That pie chart.
The pie charts are very interesting.
Yes.
Especially that they're in PTBC colors.
Very strict style guide that staff have been required to adhere to.
The out-of-state licenses, I'm surprised that our neighbor states, the adjacent states, make up such a small proportion of the out-of-state licensees. I would have thought that number would have been much larger, or even the sum of Oregon, Nevada, and Arizona combined. That number is so low.
And so for this data, the only thing that I'd ask you to kind of keep in mind is that this information is based on the current address history for the board, and for more particularly the address of record. And so some of our licensees may have a residence address in another state, but still continue to receive mail to a California address, and so that won't be picked up in this field. But I agree. I think that you would still see, you would expect to see more travel to our border states, but I also see kind of some trends in density of population kind of thing. So it's not surprising to me that California licensees tend to go to states similar in composition like New York or Florida or Texas.
Other board comments? I was surprised myself to see that 11% of our out-of-country licensees are from Japan. That's just, I guess I haven't met a foreign educated PT from Japan in California yet.
It might be a little hard because there's only 4.
Oh, that's total.
Right, so that's total. So out of all the addresses polled, for addresses that are out of country, for the existing that we have, only 38 of them are showing up.
I see.
And so then we try to sort them out. And so you'll see the combination of other countries is combined. There's actually 23 in that larger category, but which means there's probably about one in every country.
Yeah. And so, Jason, you said that these numbers are based on the address of record.
That's correct.
So, if there was somebody serving military and they were stationed in Japan at this time, and that was their address of record, would that be reflected? Would that be one of the four?
That would be.
Okay.
Other board comments? Okay, moderator, will you please facilitate public comment for agenda item 14A and B?
Thank you, Madam President. I have opened up the question and answer panel. So if you would like to make a public comment, please type, "I would like to make a comment," and submit it to all panelists. And we are displaying instructions for your reference. This is the moderator, and I see no requests for public comment at this time. Madam President, would you like me to close the Q&A panel?
Yes, please. Thank you.
You're welcome.
Agenda item 15, continuing competency services.
So this report is a little bit different than usual. Because of COVID-19, we have had to redirect some of continuing competencies resources to other areas within the board, more specifically applications, to kind of help with teleworking and that workload and maintaining our performance measures, if you will, for applicants and getting them licensed in a timely manner. So there isn't really any information to present as far as audits, pass rates, or anything like that, but wanted to bring that to the board's attention that resources have been diverted and staff for being so patient and, at a whim, be so eager to help out with their fellow, colleagues here at the board and assist in applications or anywhere for that matter. Staff has been very flexible, very willing to help out, and very willing to help each other. So I just wanted to provide that recognition to them and that explanation to the board.
Board member comment? And moderator, will you please facilitate public comment?
Thank you, Madam President. This is the moderator. I will go ahead and open the Q&A panel. If you would like to make a public comment, please type, "I would like to make a comment," and submit it to all panelists using the field in the lower right-hand corner of your screen. We are displaying instructions for your reference. This is the moderator, and Madam President, I'm seeing no requests for public comment at this time. Would you like me to close the Q&A panel?
Yes, please. Thank you.
Okay, you're welcome.
Agenda item 16, consumer protection services.
Something I would bring to the attention of the board is that in the CPS report, you will see that things have remained very static from last year to current year comparisons, with the exception of a few items when it comes to performance measures, and some of those are affected by third and fourth quarter numbers as a result of COVID. So something that the board is painfully aware of is that some of the cases, as an example for petitions that could not be heard before the board, had to go through the OAL or the OAH calendar and were kind of held up by the number or the volume of cases that were subject to that calendar. We have that same kind of inconvenience or that same situation with the Attorney General's office, as well as our own Division of Investigations, where it made it very difficult to conduct an investigation face-to-face or person-to-person because of shelter-in-place orders and mandates of social distancing and that kind of thing. So we are seeing some delays when it comes to that in the disciplinary order. I think you can see that those are reflected in the report under some of the, like the investigations target and timeline, where we've seen a pretty consistent uptick, but most of those numbers occur within third and fourth quarters. We're starting to get a handle on that. We have agreements with both the Division of Investigations and I think kind of a ratcheting down, if you will, with the Attorney General's office, and they're doing a much better job today and currently, but there was a little bit of an adjustment period, I think, for all of us when COVID hit. So if you have any questions about the enforcement report, I will do my best to answer those.
Okay, hearing no board member comment. Moderator, will you please facilitate public comment?
Sure. This is the moderator, and the question and answer panel is now available. If you would like to make a public comment, please type "I would like to make a comment" and submit it to all panelists. We are displaying instructions for your reference. This is the moderator, and Madam President, I see no requests for public comment at this time. Would you like me to close the Q&A panel?
Yes, please, Tricia. Thank you so much.
You're welcome.
Agenda item 17, probation monitoring services.
So for our final staff report, I would just, again, it's one of those things where I would kind of focus on the consistency from year to year. I think you'll see that as people come off probation, there's kind of a steady stream of attrition and succession. So people are coming on and going off. We have a pretty static number. We range, right in the high 80s to low 90s, and at times have crested up into 100 in the past. We do have a recruitment that's going to be occurring to hire a second probation monitor, and so I think that will help quite a bit, because frankly, one person trying to monitor almost 100 people makes it very difficult. Even with some of those folks tolling, keeping track of that many people and trying to check in on them during their probationary period is quite difficult. So with COVID-19, again, that has kind of limited the board's ability to travel, and so we've relied on other means of communication, electronic, phone calls, Zoom meetings, those kind of things. So Monty also provided a 3-year comparison here, and I think that illustrates it perfectly. If you look at total probationers, it varies by 1 or 2 from one year to the next. I think the most significant difference in number of folks that are actually in the Maximus program currently, it's dropped quite a bit. And I think I don't foresee any spike in that number, so I don't know quite what to make of it. I think some of the participants in the program have exercised the surrenders inside of their orders so that they can go and rehabilitate at their own pace, and you might be seeing them as petitioners for reinstatement in the future. And I think that might be okay. We've talked about it in the past where if they're going to continue to practice under this privilege of licensure, that Maximus is the standard that we apply because of its succession rate. But for those that aren't able to bear the burden of it, we understand. And that's why the condition is inside the order that they can surrender at any time during that period, and always have that due process to be able to petition for reinstatement at a later date.
So if Monty were here, I know the board members would find an interesting question to ask him.
Ooh.
But if he's not here, what questions do the board members have for Jason?
Thank you for taking it easy on me.
Okay, moderator, will you please facilitate public comment?
Sure. All right. The question and answer panel is now available. If you would like to make a public comment, please type, "I would like to make a comment," and submit it to all panelists. We are displaying instructions for your reference. This is the moderator, and Madam President, I see no request for public comment at this time. Would you like me to close the Q&A panel?
Yes, just for a moment so we can open it back up.
Okay.
Our next agenda item, number 18, and that's public comment on items not on the agenda. So if you could please facilitate public comment.
Sure. So I have opened the Q&A panel once more, and if you'd like to make a public comment, please type, "I would like to make a comment," and submit it to all panelists. And I will unmute you in the order that you make your requests, and we are displaying instructions.
This is James Sims. If I could be recognized for a question, please, or a statement too.
Yes, Dr. Sims.
I looked at the break we had at the 2 o'clock break or whatever, and that video that the FSBPT, it's on their website. So if the volume wasn't able to be turned up for some folks, they didn't get to hear it, they can go on the website for the Federation of State Boards, and it's there. I just checked it, and it's there's other ones too. So second comment is, in a face-to-face meeting, I'd fill out a little card, drop it in the box, and get my 2-hour credit. How are we going to get recognition for attending this board meeting for our CEU credit for those who are participants?
So for those board members and non-board members alike who are licensees that participated, you can request a card, fill it out, and we will keep it and verify it using your panelist and attendance record inside the WebEx app, and also for those that were watching it through webcast itself.
How do we request the card?
We're going to proactively send them out to the folks that we see on the list. If you don't receive it, you reach out to the board at pt@ptbc.ca.gov.
Okay, cool, good. And my last comment, and I try to say this every time I get to be involved with one of these meetings, and that is, you guys are so dedicated to what you do, and I appreciate it. I mean, you're public servants, maybe not the first responders and all that, but your job taking care of this licensing event and all of the difficulties with COVID and how it affects our families and our professional lives. I really personally, and I know the CPTA appreciates all the work that this licensing board does. So thank you guys very much.
Thank you, Dr. Sims.
All right.
I did want to address during our first public comment, there was a gentleman named Michael Infantino, who I don't see online today, but he had put in public comment in the first category that he wanted to have dry needling considered for a future board meeting. And he meant to do it in public comment, and it might be more appropriate to do it in the next agenda item. I just don't want to lose track of it.
Yes, in the current agenda item, public comment on items, for future meeting is what you're talking about. Yeah, it's Michael no longer on the participants list.
This is the moderator, and actually he is still on the list. So would you like me to unmute him?
I think maybe let's see if Michael will jump on. If he has anything he would like to add now, Michael, please chime in. Otherwise, if you want to jump in on the next agenda item, we'll open that up next.
So having that silent.
Yeah, okay. Sounds like we don't have, more public comment. Let's go right into agenda item 15. And should we take board comment first and then public comment?
Yes.
Okay, so we can, moderator, we can close public comment for now, please. And then board members, agenda items for future meetings.
This is Daniel Drummer. I received a request from a licensee for a board opinion or white paper or something to that effect on whether physical therapists are permitted to deliver or manage oxygen titration under a physician's orders. Apparently the discussion that has been had is that oxygen is considered a drug and that physical therapists are not allowed to deliver medications. But can physical therapists under physician orders be able to titrate oxygen?
We're familiar with that request, and it is being discussed in the same avenues as the CPTA request about removal of drains as well. So look for a response to that request shortly.
Great, thank you. I will pass that on.
Other ideas for agenda items for future members from the board? Okay, moderator, will you please facilitate public comment?
Thank you, Madam President. I will go ahead and open the Q&A panel. The Q&A panel is now available. If you would like to make a public comment, please type "I would like to make a comment" and submit it to all panelists. We are displaying instructions for your reference. This is the moderator, and Madam President, I see no further requests for public comment. Would you like me to close?
Yes, please. Thank you so much. And then,
Sure.
Mr. Kaiser, can you please bring up Michael Infantino's request from earlier?
I don't think we have the ability. Well, maybe we could bring it up in the chat.
Or just verbally?
As I remember it in the chat, it was just simply a request to have the topic of dry needling added to a future board meeting.
This is a moderator, and it's in the Q&A panel. I opened it back up, so it reads, "I would like dry needling to be discussed in the next board meeting, if possible."
Thank you.
You're welcome.
Okay. And I want to thank Michael Infantino for that comment and thank him for his time, as well as other licensees and public members, members of the public who have sacrificed time to be here today. And we will take that request into consideration. So we are now at the end of our agenda. We have closed session, and so our intentions are to move into closed session, and we will not be coming back onto webcast. We will just adjourn after closed session. So with that, I want to thank everyone again. Thank you, board members. I'll see you in closed session. Thank you to our moderator and solid team, and for all of our participants. Everybody stay safe.
Madam President?
Yes.
This is Daniel Drummer. Just wanting to, I don't believe information was dispensed about getting into closed session this time. Or was it?
No, that's important.
This is the moderator, and so closed session will be using the meeting you're in now. So what will happen is the members of the public will be dismissed. I'll dismiss them, and once they are dismissed, I will go ahead and lock the meeting, and that will prevent people from logging back into it. So you just need to stay logged into this meeting, and I will go ahead and dismiss members of the public.
Thank you very much.
Thank you.